Some very interesting stories making news this morning, and this is one of them. The Tweed Heads Hospital Medical Staff Council says there are some concerns that the new hospital won't be able to cope with increasing patient numbers under some of the business plans that are being considered for that new building up on the Coogin Plateau there. The $582 million hospital is under construction, expected to open to patients in 2023. The Medical Staff Council co-chairman, Mike Lindley-Jones, spoke to our reporter, Leah White. Here's a bit of what he had to say.
The construction has already begun digging the hole for the foundation, but we haven't decided yet exactly what services are going to go into the hospital, and we're still negotiating with the government to exactly how big the hospital is going to be and what it's going to be able to offer. When we think of a hospital, we want to know if there's going to be enough beds there to treat the population, to look after the people of Tweed. We want to know if I have cancer, am I going to be able to get the scan I need? Am I going to be able to get radiotherapy? Is my surgeon going to have enough space in the operating theatre? And all those questions are still being discussed between the doctors, the hospital managers and the ministry.
We know not far up the road to the north, the Gold Coast Hospital had a bit of an issue where they built a shiny new hospital, but within a few years the patient capacity was being tested. Are there any concerns that will happen with the new hospital here at Tweed, that they won't be given enough beds to deal with the growing population and the increased number of patients?
Yeah, absolutely. That is our biggest concern. We had imagined that the hospital that's going to be built on the new site would be big enough for the population. And when we're looking at some of the options that are being considered in terms of numbers of beds, we as the medical staff are quite worried about it. We feel that this is an opportunity for the Tweed Valley to secure its healthcare for the next 2 decades. And we're concerned by some of the bed numbers, which we think may only last us for 3 or 4 years. We're concerned about some of the numbers being talked about in regards to operating theatres, scanners, psychiatry services and so forth. We travelled down to Sydney to advocate with the Minister, and we're really hoping that the Ministry will look after the Tweed Valley, that they'll make sure that we get the services that we need. We know that in the past this has been a very neglected area, so there's a lot of hospitals, a lot of towns that have much smaller populations than the Tweed Valley that are able to provide many of the services that we can't provide at Tweed. And I think this is definitely a catch-up time. It's a time for our population to actually be given the hospital they deserve.
So is it the case at the moment that a number of business cases are being put forward and kind of worked out in terms of what resources that hospital will have?
Yes, there are a number of business cases, and as you would guess, each business case has a different price attached to it, and the ultimate decision is being considered by the Minister. We put forward that it's better to get it right first time. There's no point in building a hospital that's too small and 3 or 4 years later we find that we're going to have to renovate it, which is exactly what's happened at Gold Coast. So in 2014, the Gold Coast opened their doors, and in June this year, they opened their last 6 contingency beds. And that is not a situation we need here. We're in a place that does have a growing population. We're in a place where we need to plan for the future. And at the moment, the planning horizon is to 2031. And if you consider this new hospital is going to be opened in 2023, that's really only a planning horizon of 8 years. The medical staff who actually live and work in this hospital and experience the demand, we're very concerned about the numbers that are being thrown around.
Can you give me an idea of what those numbers are in terms of the capacity for the existing hospital and what ballpark figures are being thrown around for patient capacity at the new Tweed Hospital?
I can give you some rough ideas. One of the business cases would only have a sort of about a 15% increase in capacity. So the current hospital has 245 beds, and we believe that the hospital really needs to be double that. Every single day, even during what's traditionally the quiet seasons, we struggle with patients that are backed up in the emergency departments. And, I think the hospital actually does incredibly well to cope. We have one of the most efficient theatres in New South South Wales in terms of getting more patients through per theatre session. One of the lowest lengths of stay for any hospital in New South Wales, and despite that, Tweed is struggling. And I would have to say, we're probably 20 years too late in terms of renovating this hospital, and we've been struggling for the last decade or so. It's absolutely crucial for the healthcare of the area that this hospital's built, and it's built as soon as possible, but also that it's built right. We don't see any point in building a hospital that's going to be roughly the same size as the current hospital, or just a little bit bigger, to find that in a few years' time we're in the same position we are now.
Part of being built right also includes having the right technologies and the capacity to be able to treat things like cancer and surgeries and things like that. Is that a big issue for doctors like yourself?
Look, it definitely is. So some of the technologies that are around that would be considered pretty standard for a hospital the size, for a population the size of Tweed Valley are things like the ability to do an angiogram for somebody who's had a heart attack. These are facilities that are available at smaller hospitals such as Lismore, Coffs and Port Macquarie, Tamworth and places like that. Radiotherapy to treat cancer, a PET scanner to scan for cancer, numbers of theatres. So it's not just a bed number, it is about having the facilities to treat patients and having the technology. We are putting it to the state government that this is what Tweed needs. Tweed has been left behind over the past couple of decades. Our population really needs this hospital, so they can be treated locally and not have to be shipped up to Gold Coast, which, by the way, every day we're getting messages from the Gold Coast saying they can no longer accommodate patients from New South Wales because they're getting full themselves, so they're struggling themselves to be able to cope.
You mentioned that you'd like to see a doubling of beds from the 245 that are existing. We did have an election commitment for around 450 beds, if I remember correctly. Do we know when the government or the minister will confirm what the capacity and the bed numbers will be, when the public, I guess, will find out whether or not they've followed through with that commitment?
The last election, the major issue in this area was the hospital. And there was a commitment for 450 beds in this area, and we, as the medical staff, having gone through service by service, looking at the needs and the demands for each service, looking at the population base, looking at the ministry algorithms that come up with predictions and so forth, feel that 450 beds would be okay. We feel it would be on the lower end of what would be needed, but it would be an adequate hospital to get us through the next decade or so. If that promise was upheld, then that would be a reasonable outcome for the LHD, reasonable outcome for the Tweed Valley. Some of the numbers that are being thrown around, though, are substantially less than 450 beds. We're talking about perhaps 20-30% less than those numbers, and that's why we're concerned.
Interesting stuff there from Mike Lindley-Jones. He's from the Medical Staff Council at the Tweed Hospital.